The man hadn't spoken in 4 days. Not a word. Not a sound. Not even when the pain medications wore off and his body arched against the restraints. Not even when the attending physician leaned in close enough that their breath fogged the edge of his oxygen mask and said, quietly but firmly, "Sergeant, we need your help here. We need you to fight." He didn't fight. He turned his face toward the wall, toward the pale, institutional beige that said nothing and asked nothing of him, and he stayed there. His name was Marcus Trent, 34 years old, 3 combat deployments, a chest full of decorations nobody in this hospital had thought to ask about. He had come in through the emergency bay 6 days ago, broken in the ways that scanners could measure and in the ways they could not. His body was failing on 2 fronts simultaneously, a pulmonary crisis that was very much medical and something else, something the charts didn't have a code for, something the nurses talked about in low voices near the station and the doctors summarized with phrases like psychological withdrawal and noncompliance with treatment protocol. What none of those phrases captured was the truth. Marcus Trent had decided to stop. Not just stop cooperating. Stop. The way men who have seen too much sometimes do. The way soldiers who have spent years running toward fire, and then suddenly find themselves lying in a bed that smells like antiseptic and helplessness, sometimes decide, quietly, without announcement, that they are done. The ICU at St. Emmanuel's Medical Center was full of men and women like Marcus that morning. Veterans. 6 of them across 8 beds. Some recovering from surgery. Some battling infections that had settled in bodies already worn thin by years of service. Some fighting their own version of the silent war Marcus was losing. The ward had a particular atmosphere, heavy, watchful, charged with attention that the day shift staff had learned to move around carefully, the way you learn to step around a tripwire after you've seen what happens when someone doesn't. The medical team had a word for this ward, spoken only among themselves. They called it the fog. Nobody could reach these patients the way they needed to be reached. The doctors were excellent. Technically, procedurally. The nurses were competent, compassionate, well-trained. But there was a wall. A frequency that the staff was broadcasting on and the patients simply were not receiving. And then, at 6:47 in the morning, the ICU doors swung open, and Margaret Calloway walked in. She looked like no one in particular. She moved like someone who had learned, a long time ago, that drawing attention to yourself was a liability. She was 58 years old, with graying hair pinned back without ceremony, sensible shoes, and a badge that most people glanced at and immediately forgot. The night staff barely nodded as she passed. She was simply Maggie, the quiet one, the one who had worked this hospital for 11 years and never once raised her voice. Nobody looked up. Nobody knew. And what they didn't know was about to change everything. Section 2. Character Introduction and Mystery. Word count. 800 words. If you had asked any of Maggie's colleagues to describe her, they would have struggled. Not because she was forgettable, though she had cultivated that impression carefully over years, but because none of them had ever looked closely enough. She was the nurse who arrived before her shift started and left after it ended. The one who remembered patients' names and family members' names and the names of patients' dogs. The one who never joined the break room gossip but was always there when a coworker was quietly falling apart in the supply closet. Always there with a steady hand and no unnecessary words. She had a stillness about her. Colleagues sometimes described it as calm. They weren't wrong exactly, but they were imprecise. It wasn't the calm of someone who had never been tested. It was the calm of someone who had been tested so many times, in such extreme conditions, that the mechanism for panic had simply been overwritten by something more durable. Nobody asked where it came from. She didn't volunteer it. In 11 years at St. Emmanuel's, Maggie had never mentioned the military. She had never worn a pin, never brought it up at the holiday parties, never applied for the veterans hiring preference that would have bumped her application to the top of the stack when she first joined the hospital. She had simply applied, been interviewed, been hired, started work on a Monday and showed up again on Tuesday, and every day after that without a single reference to what she had been before. Her personnel file said she had a nursing degree from a state university and 12 years of prior healthcare experience before St. Emmanuel's. The hiring manager who had processed her application had never pressed for more specifics. Nobody had. But there were things if you watched carefully enough. The way she moved through the ward during a code. Unhurried, but faster somehow than anyone around her. Arriving at critical moments as if she had anticipated them from across the room. The way she assessed a patient in the first 30 seconds of contact, not just checking their monitors but watching their eyes, their hands, the angle of their jaw, the things the body communicated before the voice engaged. The way she responded to sudden sounds. A dropped tray, a door slammed by wind, with a brief, controlled stillness that passed through her body like a wave before she continued on her way. Not startled. Calibrated. There were her hands, too. A young resident named Dr. Priya Okonkwo had noticed it once, during a particularly difficult procedure. A chest drain on a patient who was fully conscious and terrified. Maggie had assisted, and Priya had caught herself watching those hands more than the procedure itself. They were not the hands of a woman who had spent her career in a clean, climate-controlled hospital. There was something about the way they moved, practiced to the point of instinct, sure in a way that went beyond training. Priya had meant to ask about it later. She had forgotten. Life in an ICU does that. It fills you up with the immediate and crowds out the curious. And Maggie never made herself easy to ask about. She deflected questions with questions. When patients or staff probed about her background, she tilted conversations away from herself with the seamless skill of someone who had been trained in how not to be extracted. She was warm. She was engaging. She made you feel seen and heard and important. And in doing all of that, she remained entirely invisible. The younger nurses adored her. She was the person they came to when a patient was too difficult, when a family was too demanding, when the night shift had left something unresolved and the day shift didn't know how to pick it up. Maggie always seemed to know what to do. She always seemed to have encountered some version of the situation before, even when it was the kind of situation that was supposed to be rare. What they didn't know was what kind of situations she had encountered before, the settings she had been trained in, the stakes that had been involved. They knew her as Maggie the ICU nurse, patient, competent, unremarkable. They didn't know her as Petty Officer First Class Margaret Calloway, U.S. Navy corpsman, 3 combat deployments, 2 in direct support of Marine infantry units in conditions that would have destroyed most people. They didn't know that the hospital had something she had spent years inside. A war, just a different kind. And on the morning Marcus Trent was quietly deciding to stop living, Maggie Calloway pushed through the ICU doors and clipped her badge to her scrub pocket. She looked at his chart. She looked at him, and something moved across her face. Not pity. Never pity. Something closer to recognition. She had seen this before. She had pulled men back from this before, in places that made this quiet, beige hospital room look like paradise. She set the chart down. She walked toward him. Section 3, World Building and Rising Tension. Word count, 900 words. St. Emmanuel's Medical Center had a Veterans Care Partnership, a formal affiliation with the VA system that meant the hospital took a rotating census of military veterans, most of them from the Regional Transitional Care Program and the PTSD residential facility 8 miles south. It was, on paper, a model program. The hospital had won 2 awards for it. The brochures in the lobby featured photographs of smiling staff and grateful patients. The reality of the ward on any given morning was more complicated than the brochures. This particular morning, a cold Tuesday in November, the kind of morning that made even the parking lot feel hostile, the Veterans ICU held 6 patients in various states of physical and psychological crisis. Beyond Marcus, there was Delroy Washington in bed 3, a 51-year-old Army veteran recovering from a second bypass surgery who refused to eat, refused physical therapy, and stared at the television without watching it. There was Carmen Reyes in bed 6, 29 years old, Marine Corps, whose chart listed a surgical recovery but whose silences told a different story. There was James Jimmy Kowalski, 63, Vietnam-era Navy, who had been in and out of this hospital more times than any nurse on staff could count, who was funny and sharp and cooperative in daylight but woke screaming most nights before the sedatives could catch him. And there were others, each with their own chart, each with their own silence. The morning shift had inherited all of it from the night team, who handed over the briefing with the careful neutrality of people handing something flammable across a room. The mood was, the word that kept surfacing in Maggie's mind as she moved through the briefing notes was coiled. The ward felt coiled, like something was wound tight and waiting. It wasn't unusual. She had felt this before. What was unusual was Marcus. Dr. Hank Patterson, the attending on this rotation, mid-40s, experienced, genuinely good at his job, had pulled Maggie aside before rounds. He had a habit of doing this when he was worried. He was clearly worried. "Trent hasn't responded to anything we've tried," he said, keeping his voice low even though Marcus was 3 beds and a curtain away. "We have a treatment window here, Maggie. 12 hours, maybe less. If we can't get him to consent to the bronchoscopy, if he stays in this refusal loop." He paused. "I need someone to get through to him. I've tried." Chen tried. The staff counselor was in there for 45 minutes yesterday and came out looking like she needed the counseling. Maggie had looked at the chart as he spoke. She hadn't said anything immediately. That was another thing people noticed about her. She didn't fill silence for the sake of filling it. She let it sit. She thought inside it. "I'll go see him," she said. Patterson looked slightly relieved and slightly skeptical simultaneously. "He hasn't talked to anyone, Maggie. He's shut down completely." "I know," she said. She said it the way someone says a thing when they have personal knowledge of what it means, not just clinical familiarity. Patterson caught the tone, but didn't follow it. He had rounds to do. The rest of the morning unfolded with the particular grinding rhythm of a difficult shift on a tense ward. Medications were administered. Vitals were checked. Dr. Patterson moved through his rounds with the focused efficiency that good ICU attendings develop as a survival mechanism, covering his faces smoothly so that patients saw competence and not the worry that pressed against the back of his eyes. Maggie moved alongside it all, performing her tasks, but also watching. She always watched. She watched Delroy in bed 3 push his breakfast tray aside without looking at it. She watched how he held his hands in his lap, the controlled stillness of someone managing something large and internal. She noted it. She would come back to that. She watched Carmen Reyes in bed 6 track the movements of male staff with her eyes, a slight physical bracing that happened below the level of conscious awareness, the kind of flinch readiness that didn't come from the surgery. She noted that, too. And she watched Marcus. She didn't approach him yet. She wasn't ready, and more importantly, he wasn't ready. She had learned, in places far less forgiving than this hospital, in situations with far less margin for error, that timing was everything with men like him. Go too soon and you trigger the defense. Go too late and you lose the window. She watched him turn his face back toward the wall when Patterson finished his examination. She watched the way his body sealed itself off from the room. Not the stillness of rest, but the stillness of a drawbridge that has been raised. She watched his hands grip the bed rail with a tension that wasn't physical distress. It was decision. She had seen that grip before. She had felt it herself, once, in a field hospital in a place she didn't talk about, in the 72 hours after she had carried 3 men out of burning rubble and learned, quietly, that only one of them had survived. She had lain in her own rack and gripped the frame and felt the world go very quiet and very gray and had understood, for the first time, what it meant when a person decided that the effort of being alive was simply more than they had left. Someone had come to her then, not with medicine, not with words about treatment protocols, with something else. She glanced at the clock. The 12-hour window Patterson had mentioned was already moving. She set down her clipboard. It was time. Section 4, the major incident. Word count. 1, 200 words. The moment Maggie stepped through the curtain, Marcus Trent didn't move. He was exactly as he had been. Face toward the wall, hands tight on the rail, the monitors above him logging his vitals in quiet green lines. The room smelled of antiseptic and the ghost of something floral from a card on the windowsill that he hadn't opened. Card from someone who loved him. It sat there unopened. Maggie pulled a chair close to the bed. Not to the clinical position beside the monitors where the clipboard lives, where the professional distance is maintained. She pulled it to the far side, the wall side, so that she was in his line of sight. She sat down. She didn't speak. This was not standard protocol. This was not in any nursing handbook. In the clinical framework she had been trained in for her hospital career, This moment called for therapeutic communication, open-ended questions, active listening technique, reflective language. The counselor had tried all of it. Patterson had tried a version of it. It had closed him tighter. Maggie knew why. You cannot speak veteran in civilian grammar. The words don't map. When a soldier is inside the particular silence that Marcus was inside, therapeutic communication doesn't land. It registers as one more thing being done to you, one more well-meaning intrusion from a world that doesn't know what it doesn't know. She sat. 2 minutes passed. 3. Outside the curtain, she could hear the ward, the monitors, the low voices, a phone ringing at the nurse's station. Inside the curtain, there was only the sound of Marcus Trent's measured breathing and the quiet hum of the machines keeping count. On the 4th minute, without turning from the wall, Marcus spoke. His voice was rough from days of disuse. Flat. "Whatever they sent you to say," he said. "I've already heard it." Maggie let that sit. She didn't leap at the opening. She let it breathe. Then she said, "I didn't come to say anything." A pause. "Then why are you here?" "Sitting," she said. Another silence. Longer. The kind of silence that was testing something. "Sitting," he said, like the word was a small absurdity. "It's what you do," Maggie said. "When someone's alone and they shouldn't be." He didn't respond to that. But something shifted, infinitesimal, in the tension of his shoulders. A fraction of a degree. She saw it. She waited. Then she said quietly, not as a question but as a statement. "Fallujah, or somewhere like it." And Marcus Trent turned his head. It was the first time in 4 days that he had turned his face from the wall. He turned it now and looked at her. Really looked at her, with the eyes of someone who has just heard a word spoken in a language they had assumed no one around them knew. "How did you?" He stopped. "The way you hold the rail," she said. "The way your body positions itself even now, toward the wall, away from the door, with a clear line to the exit if there was one. The way you went quiet. Not because you have nothing to say. Because you're in a place where talking feels like losing something you need to hold on to." His jaw tightened. "You don't know anything about it." "No," she said. "But I know something about this." And she paused for a moment, and then she said, without theater, without build-up, simply as a statement of fact. "I had a Marine die in my arms in Ramadi in 2005, 19 years old. I had done everything right. Everything. And he died anyway. And afterward I spent 3 days in something that felt exactly like what you're in right now." Marcus stared at her. "You were over there," he said. 3 tours, she said. Navy corpsmen. 2 with the Marines. The silence after that was a different kind of silence. It wasn't the sealed, defended silence of before. It was the silence of someone recalibrating, the internal sound of a wall coming down one brick, which doesn't seem like much, but is everything. "You don't look like," he paused. "No," she agreed. "I know." What happened in the next 20 minutes was not a therapeutic conversation in any textbook sense. It was 2 veterans talking, with the specific, unadorned directness of people who have been in places where precision of language matters, where you do not say what you do not mean and you do not mean more than you can carry. Marcus talked about his last deployment, about something he had done, and something he had not done, and the way those 2 things had compounded in the silence of the nights since he'd come home until they had grown larger than everything else in his life. He talked with the particular anguish of a person who has been carrying something that has become heavier than they are, but who has also been unable to set it down because they have not found anyone willing to help them bear the weight. Maggie listened. She did not flinch. She did not offer absolution or advice or clinical reframes. She bore witness. That is a specific thing. Distinct from listening. Bearing witness means being present in a way that costs you something, that says, what happened to you was real, and it happened, and I am here in the reality of it with you. Twice, her eyes filled with tears. She did not blink them away. She let them stand there because men like Marcus need to see that what they carry is the kind of weight that deserves tears from someone who knows what it is. At the 22-minute mark, Marcus said, "They want to do something to my lungs." "A bronchoscopy," she said. "Yes. And if they don't do it?" She held his eyes. "It's not good." He looked at the ceiling, looked at the unopened card on the windowsill. looked back at her. "Okay," he said. "Just that. Okay." One word. 2 syllables. The weight of it was enormous. Maggie nodded. She stood up. "I'm going to get Dr. Patterson," she said. And she would not have predicted this, had not planned for it. Marcus reached out and put his hand briefly over hers where it rested on the bedrail. Not a romantic gesture. Not a dramatic one. The way a soldier grips the hand of the medic who has just pulled them back from somewhere they were not supposed to come back from. "Thank you," he said. She nodded once. Precisely. And then the curtain moved. Because standing just outside it, having drifted toward the sound of something they recognized, the sound of a voice speaking in their language, were Delroy Washington, upright and barefooted on the cold floor, and behind the glass of the ward window Carmen Reyes watching, and at the end of the row old Jimmy Kowalski, leaning on his forestand, facing the curtain. They had heard. Not the words. The frequency. Section 5, the reveal. Word count. 1000 words. Dr. Hank Patterson found out the way most people find out significant truths. Not through a revelation, but through an accumulation of small things that suddenly made sense all at once. It started when he came to give his assent to the bronchoscopy. He found Marcus Trent, the man who had not spoken in 4 days, the man whose refusal had been absolute and apparently permanent, sitting up in bed, talking quietly with Maggie, reviewing the procedure on a small tablet she had brought in to walk him through it. Not just consenting, engaged, asking questions. The face that had been turned to the wall was now fully present, sharp-eyed, attentive. Patterson stopped in the doorway. Maggie looked up. "He's ready," she said. Simple, matter of fact. Patterson opened his mouth, closed it, opened it again. "How?" "She was a Navy corpsman," Marcus said, before Maggie could redirect the conversation. He said it the way veterans sometimes announce things about each other, with a particular pride, as if the information belongs to the person being named more than to the person telling it. 3 tours. 2 with the Marines. The silence that followed was the specific silence of a doctor recalculating everything he thought he knew about a situation. Patterson looked at Maggie, at the badge he had seen every day for 6 years without seeing what was behind it. "You served," he said. "Yes," she said. "You never said. You never asked," she said, not unkindly, as a simple statement of fact. Patterson was a good doctor and a perceptive man, and in that moment he had the grace to receive that statement the way it was meant, not as an accusation, but as an observation about the architecture of assumptions, about the invisible people that hospitals, like all institutions, learn to see in categories rather than in full. "How long?" he asked. 12 years active duty," Maggie said. "Retired as petty officer first class. 3 deployments. Navy corpsman. Spent most of my time attached to Marine infantry units." Dr. Chun had come in behind Patterson during this exchange. She was 29, a second-year resident, brilliant in the technical ways that medical education produces brilliance and still learning the rest. She stood now with her tablet lowered, staring at Maggie with an expression that was part confusion and part something closer to awe. "You did this before," Chun said. "This kind of patient withdrawal. With combat veterans." "Yes," Maggie said. "And you never—" Chun seemed to be trying to formulate the question. "Why didn't you ever tell anyone? We could have used your help with these patients so much sooner. The other veterans on the ward, they're struggling with the same." "I know," Maggie said. "So why?" Maggie looked at her. It was the look of someone deciding how much to explain, and deciding on honesty. "Because I've spent most of my life in places where what you know is less important than what you look like," she said. "Where being a woman, or being quiet, or being older means people decide in advance what you are and what you're not. I've learned to let people carry their assumptions. They usually find out what they need to know when they need to know it." Chun stared. Patterson looked at the floor for a moment, and then looked back up. And when he met Maggie's eyes, there was something in his expression that might have been the beginning of a more accurate picture of who she was. "The other patients," he said. "Washington, Reyes, Kowalski. Do you think—" "Yes," Maggie said, before he finished the sentence. He nodded slowly. I'll clear your schedule for the morning. What happened next was the kind of thing that doesn't get documented in medical charts but gets told and retold in break rooms for years. Patterson went to reschedule the bronchoscopy prep and came back to find that Delroy Washington, who had not voluntarily left his bed in 3 days, was standing in the hallway outside Marcus Trent's room, talking. Not to a doctor, not to a nurse, to Marcus, and Marcus was talking back. 2 veterans, comparing notes in the specific shorthand of their shared experience. The kind of conversation that takes 2 hours with a trained therapist and 6 minutes between people who have been in the same kind of dark. Carmen Reyes had been escorted back to her bed by a nurse, but was sitting up, curtain open for the first time since her admission, watching. Jimmy Kowalski had sent his overnight nurse to find that woman who talked to Trent. The overnight nurse had not known who he meant at first, and that small confusion, that momentary blankness, had somehow become the most important detail, because it captured everything. The woman who had walked through this hospital for 11 years, quietly extraordinary, carrying her history like something private, doing the work with the same steady excellence she brought to everything and never asking for recognition. The woman that no one had thought to ask about. In the ward that morning, among half a dozen broken and beautiful veterans who had been fighting their own private wars in hospital beds, something was moving. Something was waking up. The fog, the word the staff had used for the ward's mood, the heaviness, the unreachable quality, was not gone yet. But it was shifting. The way fog shifts when light finally finds an angle. And at the center of it was Maggie Calloway, who was already moving to the next bed, clipboard in hand, badge gleaming under the fluorescent lights. Ordinary. Unremarkable. Until you knew. Section 6. Escalation and hero moment. Word count. 900 words. By 10 o'clock the ward had changed. Not dramatically. Not in the way of movies, where revelation arrives in a single cascading moment and everyone is transformed simultaneously. Real change is quieter than that, and more stubborn and more earned. But something had broken open in the veterans' ICU at St. Emmanuel's that morning, and Maggie could feel it. The particular quality of attention in a room that has shifted from closed to open, like a window someone finally found the latch for. She was with Carmen Reyes when the next crisis hit. Carmen had been speaking slowly, carefully, in the cautious way of someone testing weight before committing to a foothold, about the thing behind her silence. Maggie sat in the same unhurried way she had sat with Marcus, giving the conversation room to breathe. She watched Carmen's hands. She watched her eyes. She listened not only to what was said but to the shape of what was not said, the geography of the pauses. Carmen was 29. She had done 2 tours as a Marine riflewoman and come home to a country that was not entirely sure what to do with women who had done what she had done. The surgery on her chart was real. But the surgery was not why she was shutting down. Maggie knew this without being told. She waited, and then Carmen said something, quietly, looking at her hands. Something that changed the shape of the morning. Maggie had been in this situation before, in a medical context, and before that in a very different context, and she knew exactly what it required. Not urgency. Urgency was the enemy here. Urgency said, what you have just said is an emergency, and by saying it is an emergency you are telling me it has the power to override your agency. What Carmen needed was not urgency. What she needed was steadiness. The message, what you have just told me is important, and I have received it, and I am not afraid of it, and I am not going anywhere. I hear you, Maggie said. That took courage. Carmen made a sound that wasn't quite a word. Her jaw was tight. You don't have to carry that alone anymore, Maggie said. You know that, right? That's not weakness. That's just physics. Some things are too heavy for one person. Carmen was crying now without making a sound, the specific crying of someone who has taught themselves to cry silently, which is its own kind of heartbreak. Maggie did not rush to fix it. She did not reach for the box of tissues on the bedside table, which would have been, in this particular moment, a way of saying, please stop. She let it stand. She let Carmen cry in the full sight of another human being without apology or intervention, which is sometimes the most powerful thing you can offer. 5 minutes later, when Carmen had come through the other side of it, that place of spent clarity that follows the first real opening, Maggie gently explained what would need to happen next. The conversation that would need to take place. The support that was available. The steps. She made them manageable. She made them survivable. As she was finishing, Dr. Chun appeared at the curtain and then stopped. Because through the glass walls of the ward, something was happening. Marcus Trent, who was supposed to be resting before his procedure, was sitting up and talking to Delroy Washington, who was sitting in the chair beside his bed. And Jimmy Kowalski had wheeled his forestand across the floor until he was positioned at the foot of Marcus's bed. The three of them were talking. Veterans talking. And one of the newer nurses, a young man named Theo who had been on this rotation for only 3 weeks and had found it brutal and baffling, was standing at the edge of this gathering with a look on his face like someone who has just seen, for the first time, how something works. Chun looked at Maggie. They're talking to each other, she said. Yes, Maggie said. How did you? I didn't, Maggie said. She glanced through the glass at the 3 veterans, at the particular posture of men who have found, unexpectedly, in a sterile hospital room, a version of the thing they had been missing. They did it. I just opened the door. Chun watched the ward for a moment. What was it? She asked. What did you say to Marcus that worked when nothing else did? Maggie considered this. I didn't say anything clever, she said. I sat with him in the dark for a minute. That's all. And I showed him that I knew what the dark was. She paused. You can't fake that. People who've been in the dark know whether you've been there or not. They can tell in about 30 seconds. Chun was quiet for a long moment. Then, we've been approaching this wrong. The whole time. We've been trying to treat the body and fix the mind, and we haven't been meeting them. No, Maggie said gently. But now you know. Theo, the young nurse, had drifted closer, listening. He looked at Maggie with an expression that was trying to work out how she had appeared to be one thing for his entire acquaintance with her and was now, clearly, something far larger. Maggie, he said, how long have you known how to do this? She looked at him with the same steady, unflashy gaze she turned on everything. Since before you were born, she said. Not unkindly, just true. Section 7, Emotional Payoff. Word count, 500 words. The bronchoscopy on Marcus Trent went smoothly. He was prepped and calm, and before they wheeled him out, he asked for Maggie. She came to the door of his room. See you when I'm back, he said. I'll be here, she said. It was the kind of exchange that meant nothing on the surface. It meant everything. Dr. Patterson gathered the staff at the end of rounds. This was unusual. He was not, by nature, a gather-the-staff kind of physician. He was precise and competent and preferred the language of medicine to the language of feeling. But something had moved in him that morning, and he was honest enough to act on it. He stood in the corridor outside the veterans' ICU with 4 nurses, 2 residents, and a staff coordinator, and he looked at Maggie, who was standing slightly to one side, already prepared to deflect, and he said, I want to acknowledge something. She started to speak. Maggie, he said, I've worked with you for 6 years, and I didn't know, and that's on me. He paused. You served 3 tours as a Navy corpsman. You have the kind of experience with combat veterans that no textbook creates. And we never thought to ask. Never thought to leverage that. Never thought to see you as anything other than a very good nurse. Another pause. His voice was careful and sincere. I'm sorry for that. The corridor was very quiet. Maggie looked at him for a moment. And then something happened that the younger staff members would describe later, in their own ways, to their own people, as one of the most affecting moments they had witnessed. Maggie Calloway's composure, that famous iron composure, cracked. Just slightly. Just enough to show, for one unguarded second, what was underneath it. Not hurt. Not resentment. Something older and more complex than either. Relief, maybe. The particular relief of being seen, finally, in the fullness of what you are. Thank you, she said. Simple. Direct. The way she said everything. And then, before anyone could say more, the door to the veterans' ICU opened. It was Delroy Washington. He had put on his hospital slippers and his gown, and he was standing in the doorway with his big hands folded in front of him and his face arranged into something dignified and purposeful. "Is Nurse Calloway out here?" he said. "Right here," Maggie said. He nodded. A slow, deliberate nod. "I wanted to say thank you," he said, "for this morning. For—" He paused, and when he continued his voice was quieter but no less steady. "For understanding." Behind him, Marcus, back from pre-op prep. Carmen Reyes, standing up for the first time without being prompted. Jimmy Kowalski, still with his forestand but upright. One by one, the veterans of that ward stood. Not because anyone asked. Not because protocol required it. Because she was one of them, and they knew it, and they wanted her to know that they knew. Section 8. Final message and comment trigger. Word count. 200 words. There's a particular kind of quiet hero that the world is very good at overlooking. Not the hero with the medal. Not the one in the photograph. Not the one whose story gets told at the ceremony. The quiet one. The one who shows up every morning in the soft shoes, who carries decades of experience inside an ordinary-looking life, who has made peace with being underestimated because they learned, somewhere along the way, that what you carry matters more than whether anyone sees you carrying it. Margaret Calloway never asked to be seen. She had lived inside the invisibility for so long that it had become a kind of home. But on a cold November morning in a veteran's ICU, she walked through a door and every person on that ward recognized something in her that the hospital badges and the break room conversations had never revealed. She had been in their darkness, and she had come back from it, and that, just that, was enough to bring them back too. The world is full of Maggies. People carrying histories you haven't thought to ask about. People who are more than their job title suggests. More than what they look like. More than what gets written on their name badge. Have you ever met someone who turned out to be quietly extraordinary in ways no one else knew? Someone whose hidden story changed how you saw them, or how you saw yourself? Leave it in the comments, because these stories deserve to be told.